Dr. Mubasher Fazal, sleep specialist at Bessel Sleep Center. Today we're going to demonstrate about home study, how to put it on. And I just want to recap some of the indication for home studies are, if you're unable to do in-lab study, then home study could be an option. Make sure your BMI, which is height weight index with a formula, is below 40, preferably even below 35. And that is important because the belts cannot assess adequately your breathing. And other thing is, make sure if you have heart issues or asthma or lung problem, then you need probably in-lab study. And also if you have grinding and leg movement disorder, as well as other seizure problem which needs more monitoring of your brain waves, then you are not candidate for home study. So that was the background. So now let's catch up what is home study. Home study has limited channels and is going to assess your respiratory breathing, which are events whether you stop breathing or apnea or partially stop breathing. So it cannot assess whether you're awake or asleep. So that is little disadvantage because it has only few channels. So let's talk about how to put that on. So we will be talking more. So this has this front hardware which is going to monitor and record all the data. Just make sure don't keep looking at it because it will turn off itself and you don't have to turn it on all the time. So it snaps with the belt going in one direction here, and once you snap it on, make sure it turns on the light at the top. If it does not, then the problem could be batteries itself, or it could be the way you put it together. So those are the important things. So we are putting now, as you can see, this comes up. So what it's telling me is noticing this channel, and that is important as we talk. Second thing is, now we're gonna demonstrate how to put the oximeter. So the oximeter actually goes also on the attachment here, and we'll be showing that this attaches to this clip here, and then that should be working to notice your finger. As you can see, the red light comes on and it should be on. So this is going to be monitoring. Maybe secure it this way so it's easy for you. Third thing is about the nasal cannula. This you're going to use that, and those to go to the nose, and then this thing attaches to the top of the clip here, and I will be showing that in a minute. So this one should be the this end. As you can check it out, this end attaches here and it screws it on. So that's important. Those are the important things to remember. So demonstrate how to put this belt on. So I'm showing on my coat, but you will be actually wearing on your shirt. So this has to go like this here, and then this holds this on the front here. So this, it should be very tight, but enough that it notice your breathing. It should not be on your belly. So when you see this will be the home study kit, which you'll be getting from us. As you can see, it has a couple of instructions here, and I will again go over those with you. So this has a respiratory channel for putting on the nasal cannula, and this goes on the two nostril and goes around, and is going to attach to the respiratory channel here, which measures your inflow and outflow. So this attaches here. Then we have belts, and those are supposed to go on the chest, and there should be actually not very tight but enough to notice the breathing. So you have to put it on top, not on your belly, and these are the belts. And then the third is your oximeter, which could be any finger, and it is attached also to the machine. So those are the three channels which are important in assessing your breathing. So now we're going to demonstrate how to put it on correctly. And once you are done with this light will turn off, and don't worry about it. Now if you go to the bathroom, it will be working, and you can pick this button so to tell that you use restroom, but it won't turn off and on. So once it's on, it will turn off once you take it off completely. So that is important here. And we analyze the data, and we look at efficacy and see if it is enough to demonstrate all we need. With that, you can always call the on-call doctor, which is myself or any provider, and then our number 866-938-9996, or log on our website. Take care. If there is ever emergency, to call 911.